Welcome to Magnolia Medical Minutes, your local source for expert medical insight, direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens of Super Talk Mississippi Media, and today's special guest is Express Care nurse practitioner Brittany Taylor. Thanks for joining us today, Brittany.
Thank you for having me.
So today's topic is bike and ATV safety. What are the most common injuries associated with an ATV or bike accident, and how can these be prevented?
You can have injuries as serious as head trauma or spinal cord injury, but then you also have lacerations, abrasions, which a lot of people call road rash, and then orthopedic injuries like a broken bone. The best way to prevent these is, always wearing your protective gear when you're on any of these.
So what role does speed and terrain play in the likelihood of accidents?
So higher speeds can decrease your reaction time. It also increases the force of impact on a crash. Unfamiliar terrain or not following proper public road guidelines can also increase your risk of rollover, crash, things such as that.
So what are the key safety recommendations, including protective gear, for children and adolescents with riding ATVs or bikes?
Number one is always a properly fitted helmet, making sure you have the protective gear, elbow pads, knee pads, anything that you might need depending on what you're riding. Making sure there's an adult present, making sure that they're aware of the public road laws, and then avoiding any high traffic areas if you're going to be on a bicycle especially.
Are there any warning signs after a fall or a crash that indicate someone should check for or seek medical attention right away?
So, obvious head trauma, loss of consciousness, if you have confusion, slurred speech, chest pain or shortness of breath. If you have abdominal trauma, notice blood in your vomit or urine, you would need emergency care immediately.
So, I guess lastly, how can the Express Care help evaluate and treat injuries from an ATV or bike accident? And when should someone decide to choose between the Express Care versus the ER route?
So Express Care can treat more minor things, small lacerations, small bone, broken bones, road rash, we can treat that, but more major like abdominal trauma, head trauma, deformity of the bones, that would need emergency care.
When would someone be able to access you guys?
So Express Care is open Monday through Friday, 8 to 7, and 8 to 5 on Saturday and Sunday. So 7 days a week, we can help you with those.
Awesome. Thanks for joining us today, Brittany.
Thank you.
Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical insight direct from providers at MRHC in Corinth.